In October 2020, Governor Gavin Newsom and his HHS Secretary, Mark Ghaly, helped launch Perkin Elmer's coronavirus testing facility in Valencia, vowing it will increase California's overall testing capacity by at least 75%.
This lab is happening right at the right time.
Today, the first step in really getting a handle on the pandemic in California is testing.
2, 1.
At the time, Perkin Elmer was awarded a $1.7 billion contract from the state.
Perkin Elmer have been...
The lab has performed tests on samples from over 1.1 million Californians, but a new state investigation is finding, quote, significant deficiencies in the lab. We spoke with Secretary Ghaly.
With any big endeavor like this done so quickly, we knew there were going to be growing pains.
We first discovered a high number of inconclusive COVID results.
California launched an investigation into Perkin Elmer after reporter Julie Watts aired a series of stories on CBS 13 in Sacramento, talking to whistleblowers alleging problems at the lab.
By the end of January, when inconclusive results from the lab had quadrupled to more than 36,000, the state had a new explanation. Their highly sensitive test detects lower levels of the virus, which they report as inconclusive.
Dr. Ghaly says those numbers are misleading. He says out of 1.5 million tests, 60 had incorrect reports, and 250 samples were unable to be tested. That's way less than 1% of samples.
Some of those very small number were not able to be processed, and those individuals were notified to get retesting as appropriate.
Lab techs asleep while processing COVID samples.
Watts also aired videos purporting to show lab techs literally asleep on the job.
If any of this is happening, we need to correct it right away.
Dr. Ghaly says the state's investigation isn't complete yet, but so far, it's found the lab has fixed its problems from early on.
Nothing of major concern coming back yet, but it's not complete.
In a statement, Perkin Elmer's CEO told us his company, quote, remains confident in our continued positive impact operating the highest quality laboratory to serve California residents.
From what you've seen so far, are you comfortable with California continuing with this lab?
I am. We are going to continue to work and keep making it as great as it can be. Nothing is without areas of improvement and important changes that need to continue to be looked at and addressed.
Dr. Ghaly says the Perkin Elmer investigation could be completed in the next few weeks, and it will be released publicly. In the meantime, he says testing remains vitally important, especially in learning new information about emerging COVID-19 strains.